We have seen increases in cases, of course, across the state, and a late metric is that hospitalization data, which we are now seeing an increase in. The magnitude and timing of reductions in transmission will determine the severity of COVID in Colorado in months ahead. So we are at a critical moment. I'm just going to quickly go through some state data and some slides that we got from the health department. As I said, the numbers of cases reported across the state are increasing at a dramatic rate. They have been since our Labor Day holiday. We have not recovered since then. Colorado as a whole has moved into a severe red category as related to other states across the nation. We're right here, you probably can't see, it's this black bolded area here. So we are seeing cases, 7-day cumulative incidents of greater than 175. And so that's where we are compared to others in the state. This was updated on the 27th of October. Hospital admissions, as I said, this is the percent change by week. We are seeing a dramatic increase in hospitalizations right now since our Labor Day weekend. What's important to understand is that this is our highest 7-day average since April 29th. And so that is a huge concern for the governor and the health department and all of us in public health. What is our hospital capacity statewide? This is a question that we often get. So pre-COVID, you can see the numbers of hospital beds we had across the state has about increased approximately by 4,000. ICU beds has increased, almost doubled. And then we have alternative care sites that you might hear the governor speak about. This, one of them is at the Colorado Convention Center. There's one on the Western Slope. This would increase the state capacity by an additional just over 2,000 beds. And what's important to understand that these are just not COVID beds. These are beds that we want to have available. We need to be able to care for everybody who needs hospitalization in that high level of care. So it's not just COVID patients, but it's all of our other types of illnesses. You know, and for us, certainly during ski season, that includes all of our orthopedic injuries that we have a lot of during ski season. The other thing that we hear a lot about, and we are getting questions a lot about, is the mortality rate. And yes, the mortality rate has decreased since we saw this illness come to our state in early March. The care has improved. That has decreased mortality. We also know that those highest at risk for severe illness are also heeding most of the guidance that we are providing and following what the recommendations are. What's important to understand, however, is that the average age for hospitalizations is actually 57. The average stay in the hospital is 5 days. We do not know a lot about this virus yet. We are hearing many, many stories of people who are healthy that get severe illness and continue to struggle with symptoms of this virus. It does attack every organ in the body. So it's not typically like a flu where it's really just a respiratory illness. This really does attack every organ in the body. And even those who were healthy before they got it ended up in the hospital and continue to have long-term effects going on. We also are hearing new research happening and coming out all the time about immunity. A lot of people wonder, well, why can't we just open things up and let everyone have this illness and get it done with? Immunity wears off, they're seeing now within 3 months for some people. And if it's like any other coronavirus, which COVID is a coronavirus, which is also similar to cold and flu viruses, we know that most people can be reinfected with a typical coronavirus in 6 to 12 months. So this is why it's really important that we continue on with following this guidance. We know that mask wearing, physical distancing, avoiding gatherings can prevent the spread of this virus and protect those most vulnerable for severe illness. Right now, even though we saw early on across the state that we were having increases in the 20 to 29-year-olds, that has driven the virus spread in our state, and now we are seeing increases in hospitalizations among all age groups at this time. Now let's move to our Summit local data. Compared to the state, we have a 2-week cumulative incidence per 100,000 of 548 compared to the state at 325. We also get a question about this metric a lot. This is a standard metric that's used and has been used before COVID to be able to compare larger urban areas with smaller populations. It's a statistical method of being able to compare the two based on the population sizes. And then we have a 2-week average positivity rate here in Summit County of 10.6% versus the state, which is also increasing currently at 6.8. What's important to understand about positivity rate is that this is all of the positive tests versus all of the tests that we take, the percent of positives that we get of those that are positive tests. If we are above 5%, that means that we're not who has the virus, and that we need to increase testing. So we'll talk more about that in a minute. We really need to see this positivity rate get down below 5%, where it was all summer long before our Labor Day weekend hit. This means that we're really not identifying everyone who has the virus in the community, and we're not really understanding how widespread this virus is right now. For those of you who are familiar with the DIAL framework, and we can talk more about this if you have questions, this is the state came up with a way of 3 metrics that all counties now are having to be bound to that determines which phase of restrictions that we have to comply with. So these 3 metrics include the 2-week cumulative incidence of cases per 100,000, the 2-week average positivity rate, and as well as the 14-day declining or stable hospitalizations. These are the numbers for Summit County. Again, this is very alarming. We have in the past week jumped into the stay-at-home category for our cases per 100,000. We have had, sorry, I'm just catch myself up with my notes here. We had 170 cases in the last 2 weeks, which is really alarming and concerning. If we continue on this trajectory, we will and may have to move back to a stay-at-home. Right now, since we have been in such high numbers for so long, we were required to have a consultation with the state health department on Wednesday. And what came of that meeting was, because we already put in some higher restrictions that are targeting where we're seeing our numbers, that public health order came out last Friday. We were able to negotiate with them to give us 1 more week if we were to add a couple more restrictions to our public health order that focused mainly on gathering sizes, because that's where we're seeing them. So we did add on our public health order yesterday to restrict our indoor event size to 25 and our outdoor event size to 75 with using the distancing calculator, which is 144 square feet per person. And so that new order is in effect right now, in addition to the other pieces of the order that came into effect yesterday. The other thing I want to talk about before I move into the public health order is we will have another consultation with the state health department on Wednesday. And if we are not able to see our numbers plateau or decrease, then we will be moved into safer at home level 3 restrictions. And so we'll talk about what that means. And if our cases continue to show that they're in the stay at home level for 2 weeks after that, we will likely be moved into the stay at home phase. Again, this is, if you're familiar with our current website and the data that we have there, this is from our local website, and you can follow along the data on that website. And this is just another way of showing how our cases have been increasing exponentially since Labor Day. We have not recovered since that holiday. We did, after Memorial Day and July and the 4th of July, we did a great job in our community all summer long with the huge influx of visitors. We were not seeing an impact on our own residential case numbers, but that has not been the case since Labor Day, unfortunately. This is another graph from our website, and um, as you can see, the dark orange here is that 20 to 29-year-old age group. But what we're also starting to see now is increases in all of our age group. And this is what is concerning for us, because once we have this large spread of virus transmission within our community, what's going to end up happening is our vulnerable population will be affected, and those who are most likely to have severe illness will be affected. And for them, unfortunately, some of the outcomes might include, death. And this is something that we would like to prevent. These are all preventable deaths in our community. And so we're very concerned about seeing the rise in numbers in this way, and how we're now seeing it happen in all of our age groups. Again, the trends that we're seeing are the same with when we spoke to you last time. I think it was just a few weeks ago. We're continuing to see trends in outbreaks within gatherings. That's in personal gatherings, social gatherings, among workers and co-workers after work. That's where we're seeing most of our spread. Again, mainly in that 20 to 29-year-old group, but we are now seeing it, of course, as you saw recently, in our high school age group, as well as some of our older adult populations, 30 to 50-year-olds. Going to work sick is another trend that we continue to see. So employers, it's really important to implement that PDP and the symptom tracking. Symptom tracking isn't just temperature. We do hear a lot about folks doing a temperature check, but it also includes asking about other symptoms, because nobody should be at work while they're sick, and we're encouraging everyone who is sick to get tested. We are also seeing trends happening within meetings at offices, and within offices taking place in gatherings larger than 10, also in smaller meeting rooms with a lot of people. We're also seeing spread among break rooms at facilities happening. So these are all important things. The other thing I'd like to add to the symptom tracker is, now that we have a lot of people in quarantine, an additional question that employers might need to add to this questionnaire is whether or not they've been told to quarantine or isolate at home. Because we know for anybody who has had an exposure outside of work, they are supposed to be in quarantine, and it is important that they follow those instructions. And if employers can ask that extra question, sometimes that helps identify when someone should actually be at home, even if that exposure wasn't at work. It could have been outside of work. Staff staying in restaurants after shifts end and customers leave without masks. This is another area where we were seeing a spreading of illness and led to some of our more strategic mitigation strategies. And then, of course, the holidays. The holidays and breaks continue to be a huge concern for us. As we've seen, we've had spikes of the virus after every holiday. We're worried what we're going to see after the fall holiday and break from the school. And of course, we're on the brink of another holiday this weekend with Halloween tomorrow. We're really encouraging our community to not do traditional trick-or-treating, come up with alternative ways to celebrate this cherished holiday. Stay dark and stay home and be safe is what we're actually advocating for this year. The other holidays that are coming right after that, Thanksgiving and Christmas, are also extremely concerning, because these holidays invite multiple generations to come together. It includes people from multiple households, which again is would be violating our order at this point. But it also brings together folks who might be most vulnerable for severe illness. So we're really encouraging people to rethink their holiday plans and do alternative ways of celebrating these virtually with those family members. Our new public health order, I just want to go through what the limitations are. These public health orders are on our website, so you can go back and see what the latest public health order has in place. But right now, the order is that we have no more than 6 individuals indoors, and that's from no more than 2 households, no more than 10 individuals outdoors, and with no more than 2 households. These are for private and public gatherings. No more than 10 individuals indoors and or outdoors from no more than 2 households at our short-term lodging operations. Restrictions to party sizes, party size at restaurants is also been decreased to 6 people and fewer and a maximum of 2 households. Requirements for short-term lodging that we have now detailed in our public health order is that these entities are responsible for validating folks who are showing up are the actual people who rented the short-term lodging. We've seen over the last couple months that people showing up are not necessarily the folks who are renting, and oftentimes might be children of those who have rented the facility and end up inviting many more guests than are allowed. And so again, we also are requiring that short-term rentals confirm the identity as well as the group size of all renters upon arrival. Make sure that no more than 2 households are there and no more than 10 individuals. We're also limiting non-critical businesses to 25% of total by maximizing the use of telecommuting and developing in-office rotation schedules. And then the last one, which we just added yesterday, as I mentioned, and was required by the state to give us 1 more week, was the limitation to indoor gathering sizes to 25 and outdoor gatherings to 75 using the CDPHE distancing calendar. What's most critical for everyone to understand right now is we have 1 week, actually less than 1 week now, to see our case numbers plateau or decrease. On Wednesday, we will be meeting with CDPHE again for another consultation to see if we move into level 3. 1 week, that's not long, less than a week actually, for a community to get back on board and step up and make good decisions to keep our community open. If we were to move to safer at home level 3, restaurants will be reduced to 25% capacity or 50 people per the space calculator. Retail will be reduced to 25% capacity. Personal services will be reduced to 25% capacity or 25 people per the space calculator. Offices will be 25%, which we already have currently in our public health order. Gyms and fitness centers will be reduced to 25% capacity or 25 per the space calculator. Group sports will need to go virtual or outdoors in groups of less than 10, and outdoor recreation reduced to 25% capacity or 10 people. A lot of people have asked about ski resorts. Ski resorts are not listed on the dial as restricted, but of course all the buildings and retail and food services on the mountain will also have to comply with all of those specific industry guidelines. So again, we're really encouraging all of our industry partners to step up, make sure we're following the 6 ways to stop the spread, including wearing a mask, washing your hands, staying 6 feet apart, stay home if you're sick, get tested if you're sick, and of course get a flu shot. It's really critical for people to get flu shots this year, because if people get severely ill with flu, they'll be competing with our hospital and medical resources that could be utilized for COVID and other injuries, such as orthopedic injuries, that we need to have our hospital stay open for and not be overwhelmed. It's really important to understand that we have been doing a lot of drive-through pods. We had our 3rd drive-through pod this week, and we are doing a pod as a point of distribution for flu vaccine. We've also been doing a lot of smaller vaccine in different communities. So far, our health department has given 1,241 shots at these points of distribution. There are lots of places to get flu this year. The pharmacies, all of our providers have them as well. And then we'll be targeting neighborhoods and areas where we see less access for folks of getting the flu shot. So if you have questions, I can talk to you more about details of that. But thank you for those of you who did participate in our drive-through pod. This was a way for us also to practice our ability to vaccinate a lot of people when we are eventually going to get the COVID vaccine, which of course is coming, and that is the light at the end of the tunnel. So we really need to step up and keep on track with the strategies that we do know work. which are these 6 ways of stopping the spread. What employers can do to help with this is, of course, follow the physical distancing protocol that you're all required to have on site, but also talk to your staff. During staff meetings, let them know what our case numbers are. I don't know that everybody is hearing the message that we're getting, and so it's an opportunity for you to share with your employees how dire this is, encourage them to make healthy choices outside of work. Testing is another thing that we talked about. We are, in the next week, we will be increasing our capability for testing. We have Centura on board right now, who's been a great partner, and we have our community testing site right now, but it is not meeting the demand of testing that we need right now. They are doing 140 tests a day. We have Vail Health coming back in to stand up another community testing site. This will be in Frisco as well. This will start this week. Our community care clinic continues to do testing for their patient population, and have been since the beginning. We also will be implementing curative testing at the schools through school-based health in partnership with the school district and the community care clinic. The curative is a self-administered swab, cheek swab test that requires less personal protective equipment, and so it can be safely done at the school. This will be a way that we can seize the opportunity to test those students who arrive to school with symptoms or have symptoms throughout the day, so that they don't have to then stop at and go to another testing site. So it's a way that we can identify them right away at the school district. So it's a great resource that we'll be bringing on board this week and next week. And then we've also reached out to CDPHE, who will be able to come bring another testing site that we're going to stand up in the north end of the county. Details to come. This will not be a permanent testing site, but again, because of our high positivity rate, we need to bring in more testing to really see and identify as much of the cases that we can. So that site and more information on that site will be forthcoming, but they likely will only be a short-term capability for us, maybe 1 or 2 weeks. Vail Health will be able to increase our capabilities by 200 tests a day. So we're really looking forward to having them come back and be a partner for our community. And with that, I'm going to turn it over to Lauren. She's going to talk a little bit about contact tracing. And thank you, Lauren.
Hi, everyone. My name's Lauren Gilbert. I'm a nurse with public health, and in the emergency response, I'm a lead for the contact tracing team. My role is shared with Steve Procyse, who's an environmental health specialist. So without further ado, I'll get started so that we have plenty of time for questions. So in the role that I'm in, the contact tracing team, we receive all the positive cases of people that reside in Summit County. And the way that that's determined is basically whatever address they write on their test requisition form when they go to get tested. So we start our interview and we confirm residency based on a federal definition of residency, which I can share if there's interest about that. So we complete our case investigations, and through that we do follow up with close contacts. At times, if we identify close contacts that are meeting our clinical definition for symptoms, our criteria for symptoms, we identify probable cases that way and conduct interviews with those folks too. Our typical timeline for interviews is to try to complete all interviews within 1 working day, and then close contact follow-ups within 24 hours of receiving that information from the case. Now, obviously, this can get delayed if we don't get the information that we need the first time that we do the interview. You know, sometimes when we're working with big groups, more and more information comes out, the more people that you talk to. And so what really helps us be efficient is if folks are forthcoming the first time that we reach out to them, so that we don't have to go back and re-interview cases. So the way that we interface with businesses is we We'll reach out to businesses and notify them if we identify a positive or probable case that worked while infectious. And then sometimes we have businesses reaching out to us if the business receives information before we do. Sometimes that can happen if the case gets results and shares the information with their employer before we're made aware of that. So I would say the current trend right now, just anecdotally, is we're seeing a lot of cases every day, and outbreaks in food and beverage and hospitality. So it really seems to be hitting those industries pretty hard, and we're trying to work as efficient and as quickly as possible to identify and quarantine and isolate cases in close contacts. A little bit about what businesses need to know. So when we contact you, we usually need to confirm information like schedules and contact information. Sometimes we don't have contact information for a case if it wasn't written on their lab requisition form. So having that information available on your employees really helps us be efficient in our investigation. And then we can determine, with the employee and the employer, if there's other close contacts that we need to be concerned about in the workplace. So typically having that demographic information handy can be really helpful for us in order to quickly notify folks. So we put together a little worksheet because these days we have so many cases and we're so busy that we don't have the time that we did to spend sometimes with employers on the phone. So if you contact us and you have a positive case in your business and you need to know what to do, we can send you a worksheet so that you can get started getting down and sorting through the information that we'll need to complete the investigation. So that's just one piece we put into place so that if we're not available right when you call us, we can get you started on the path that we need. I do want to go over outbreak definition. There's been a lot of comments on outbreak definition in the community, and just want to notify businesses what this means. So an outbreak is defined by CDPHE, the Colorado Department of Public Health and Environment, as 2 or more confirmed cases of COVID. So a confirmed case is someone that's positive with molecular testing. So that's usually the PCR test, which is the gold standard. 2 or more confirmed cases of COVID-19 in a facility or non-household group with onset of symptoms in a 14-day period. So when we identify this in a workplace, we work to confirm inter-facility transmission and ensure that we feel confident that the cases that are infected are because transmission occurred in the workplace. So we can usually confirm that if cases had no social contact outside of work. So I just wanted to address that and can speak more if people have questions about that. The contact tracing team is available 7 days a week from 8:30 to 5. And then after hours, if folks are interested, CDPHE epidemiology can be reached for urgent concerns that can't wait. I will share that our response time has been delayed for the last couple weeks and will continue to be delayed due to just a high volume of cases. And we just have to triage calls based on urgency. So you might not hear back from us right away, but we will try to get back to you within 1 working day. And we're just doing the best we can right now with a high volume of cases. One question in the chat that I did want to address, the question was, I have a personal friend who tested positive with COVID-19. She was not allowed by her doctor to come in for her annual physical until she had 2 negative tests. She had 10 positive tests before her 2 negative tests. She was told by the health department that each positive was treated as a different case. That would not be the situation for our public health department just because of the way that test results are reported through the electronic reporting system. If that happened, 10 positive tests, all those events will be added to the same profile. And we do have guidance from the CDC on persistent positives. So I can share that with you of how we would treat that. But essentially, if someone tests positive for a second time within the first 90 days and they don't have symptoms, they aren't treated as a new case. In regards to 2 negative tests, we would not recommend a test-based strategy to release someone off isolation, just because the test is detecting the RNA, and the RNA might still be in the nares after someone is no longer infectious. So it's really not a good indication when someone ceases to be infectious. The data shows that typically people aren't infectious 10 days after onset of symptoms. So that's what I have to share, and I'll just keep an eye on the chat and see if there's any questions, but I will let the other speakers go and just try to respond in writing. So thanks everyone for being on the call, and please reach out if you need anything.
Thank you, Lauren. I think Dan is next. Yeah, thanks.
Hi, everyone. My name is Dan Hindershot, Environmental Health Manager with Summit County Public Health Department. And just for background, Environmental Health Department is typically the department that kind of enforces the public health laws in our community, such as restaurant inspections, water quality type inspections, or air quality inspections. We're working closely with our law enforcement partners to increase enforcement activities in the county. You can see here, Amy's sharing her screen on our total calls to our 8600 number since March 1st, our 455 calls. Now, our 8600 number, for those of you that don't know, is essentially the non-emergency phone number that you would get to dispatch, similar to calling 911. We don't want to call 911 for public health order violations. Typically, that should be reserved for very acute, dire emergencies. And so instead of calling 911, you would call this 8600 number, which is 668-8600. And so we've had 450 calls since March 1st there. 49 have resulted in warnings, whether that be a business who is not enforcing mask wearing by staff or customers, or parties that are exceeding the numbers at a private household. All varieties of calls have come in to that line. Total notice of violations or cease and desist letters notified to public health from law enforcement have been 5. And most of these have been in the early on around the stay at home time period, where people were having gatherings and that sort of thing. Let's see, and basically telling them to cease and desist the gathering that they were having. 9 quarantine or isolation orders issued. And so people are probably surprised at this number. There's only 9. So what we typically do in Lauren's team over on the contact tracing side of things is when they identify someone who's positive with COVID or a close contact of someone with COVID and need to isolate or quarantine, we issue more of an informal letter. Most people in our community desire to be compliant. They don't want to be responsible for spreading COVID in the community, right? But there are a few people who are resistant to our requests. And so in those cases, we do issue a more formal order that is a little bit more enforceable, gets us a little closer to enforcement with the courts should that person violate the orders. So there's 2 strategies as we're looking at how to decline our numbers here in Summit County. And I think everybody kind of focuses more or less on what do we need to add to our public health order in order to get more compliance. And as you've heard from Amy's presentation, we are doing a little bit of that. We're adding additional restrictions to our public health order. But then the other side is there's a lot in our order that if everybody would follow it, we wouldn't have the incidence of COVID cases here in Summit County. And we also need to look at enforcing what's currently on the books more diligently. And so we've got a meeting here in just the next hour or two with our law enforcement folks in the different areas, such as the municipal chiefs or the sheriff for the county. They're very cooperative in us working together to issue more tickets in the community. And so what our protocol is at this point, we can't define it for every situation. Every situation is a little bit more unique and poses a different threat to the community for COVID. But it's still going to start with education for the most part, unless it's an egregious violation. But there are a lot of people out there who, for whatever reason, still are unfamiliar with the public health orders. There's even a few people who don't understand that their business needs to complete a physical distancing protocol, different things like that. And so we'll generally start with education there. If we see repeat violations, we'll go straight to issuing tickets. Or like I said, if it's an egregious violation, like someone exceeding some of the numbers that we've established for personal gatherings, more than 2 households in a personal gathering, a business exceeding, their percent capacity perhaps, or not wearing masks widespread, that may result in an egregious violation, which will be, the persons responsible will be issued a ticket and funds to appear in court. Violations of the public health order are subject to penalties up to $5,000 a day, which will be determined by the court depending on how egregious the violation is and that sort of thing. I do want to be clear, we talk about education as a first step, but that doesn't negate the responsibility of everybody to be in tune with how to run their business responsibly. And so I want to make sure that you all have tools to do that. We get a lot of questions about how do I run my business? And the best place to start with that is on our website. We've got business resources and our roadmap to recovery. The document lists all the different activities that, well, not all the different activities, there's always gray areas, but it lists most business activities in the community and what they're responsible for following if there are guidelines. All businesses in Summit County, as Amy mentioned, need to fill out the physical distancing protocol. That's the foundation for all businesses to operate. Thanks, Amy. And so it starts off, you can see, with just identifying what the business name is here, what kind of signage is requirement, and then it goes into measures to protect employee health. Boy, I would say a lot of our outbreaks that we're seeing, we talk a lot about the social gatherings, but next to that is probably just transmission within a business from coworker to coworker. We're not seeing guests get infected quite as much from other guests or from staff. It's usually staff infecting other staff. So safety and health is critical here. It starts with doing symptom checks and monitoring that and monitoring staff, documenting that if you feel that that's, you can keep that information protected, because we want to protect this information from HIPAA violations, of course. But as business owners, you're responsible for checking and making sure that folks are not showing up to work sick. This physical distancing protocol also goes into things right at the very end about transportation. You know, we know that sharing a work vehicle is a close, confined environment. This physical distancing protocol addresses that, and many, many other things. So go to the website, find that, complete it, hang a copy in your entrance to any of your business entrances, whether that be for customers or for staff, so that everybody can see that. Then we've got the, let's see if that covered everything on that. Yeah, and feel free to reach out to us if you have any questions. If you want to report violations that you're seeing, use that 8600 number. So another question that we've been dealing with here quite a bit, and we know you have all been dealing with as well, is, okay, you're checking for symptoms when staff show up, but what do you do with that information? What if someone has the sniffles? What if they have a headache? What if it resolves in 24 hours? Is that a reason to allow them to come back? Does a negative test allow someone to come back? What if it's a little bit of sniffles and congestion versus a loss of taste or smell? We've all heard that a loss of taste of smell is a little bit more telltale sign that you likely have COVID, more likely have COVID, right? And so we've got a final draft developed for this, and we should have something out to you all in the next day or two. And I apologize that we haven't had something out sooner for you all. We've really just been hoping that the state would produce something, and we haven't seen that yet. And so we are taking the liberty of creating our own. But we need to be responsible with that. So we'll send that out here soon. Ski areas is the last topic I wanted to talk about. And so I've been kind of leading a awesome team that includes all of the ski area CEOs, county management, and county commissioners, so that we can responsibly plan for the ski season coming up. We know that the ski season operating here in Summit County is critical to our economic well-being. It's also critical to our physical well-being. And so as we're trying to determine COVID, we also need to balance it with those other factors. So we look at ski resorts, and we go, is that a big risk? Are people being outside in an environment where they're not coming together like in a concert, where they're just shoulder to shoulder, right? People go skiing to be in the outdoors and usually to physically distance. You don't want to go to a ski area where you're bumping into other people. However, ski areas typically operate with thousands of people. Those are big numbers that catch our attention when we start talking about COVID. So the first thing we looked at was just visitation. We know, as Amy mentioned, we had a very successful summer, and we had some of our data shows 110% visitation from what we experienced in 2019. And yet we managed COVID as a community very successfully over the summer. So as we started looking at winter, we said, well, maybe the sky isn't falling. Maybe the winter ski area activities are going to be more similar to what we experienced in the summer. We also know that COVID is spread indoors up to 20 times more than it's spread outdoors. So when winter comes, people go inside more than they are in the summertime. And so we started looking at that and looking at our visitation, and our conclusions were that we don't believe that we're going to have a significant increase in destination visitors from what we saw during the summer going into the winter. Some of our resorts are anticipating that they're going to have slower seasons this year than in past years. But we do expect that we're going to have increased visitation to Summit County in the form of day visitors. And so folks coming up from the Front Range just to ski for the day. We've evaluated data that shows that we do see that population increasing significantly in the winter versus the summer months. So we all know when we go skiing, some of those days on the buses or in the lift lines or in the lodging areas, not the lodges like housing, but lodges like restaurants, can be very, very crowded on those busy days. And so is that an environment that promotes physical distancing? No, it's not. But on a lot of days at the ski areas, people are well spaced. And so we wanted to determine, do we need to have capacity limits at our resorts? And like I said, all of the resorts looked at this and shared the common conclusion that we do need to address overall daily capacity limits. And all of them will be adopting daily capacity limits. All 5 of our ski resorts. That includes the Frisco Nordic Center and the Frisco Tubing Hill. They also have a little ski area there. So another thing we looked at was just staff safety, whether it be personal protective equipment, mask wearing, symptom checks, And then housing was a big concern for us. We know that the transmission is generally occurring in a work environment from employees to employees, and especially when folks are living closely together. And so all of the resorts have come up with good plans for that. And then should any of those employees need to go on quarantine or isolation, they need to be able to do so in a way that is maybe not in as dense of a housing situation as they're accustomed to experiencing. And so they're reserving rooms so that folks can achieve quarantine and isolation successfully. We carefully looked at lifts and gondola capacity and established seating arrangements on the chair lifts and in the gondolas that we feel will minimize the risk of COVID transmission in that very outdoor, high ventilation environment there. And then transportation, they're all adopting transportation guidelines on their bus systems in different areas. And then finally, a lot of their ancillary services such as restaurants and retail, rental shops, that kind of thing, are already covered by existing guidelines that exist for many of our businesses. So they'll be following those as well. But we do know that we need to account for acute emergencies. If a really nasty blizzard comes in and people are trying to get in and out of that outdoor environment where they could potentially get frostbite or worse, they will have to plans for emergency sheltering as well. So with that, I'll go ahead and turn it over to the next presenter. Thank you.
Thank you so much, Dan. Hannah, I think you're next.
Hi, everyone. My name is Hannah Wind, environmental health specialist, but also the public health liaison to our County Emergency Operations Center, the EOC. I know we're running short here on time, and we wanted to save a little bit of time for some more questions. So I just wanted to mention some resources real quick that we've kind of mentioned throughout the presentation, but that you guys can write down if you guys have questions that come up in the future. The first is our COVID public information hotline, which is that 668-9730 number. We've got people answering that Monday through Friday office hours, and then we also return voicemails over the weekend for that phone line. And then in addition, we have our COVID questions at summitcountyco.gov email address. Please allow at least 24 to 48 hours for us getting back to people on that. I mean, as you can imagine, we've had quite a flood of questions flooding into that, but we are doing our best to get back to those as quickly as possible. So some of those questions I know we've been trying to address in the chat, but if you still have further questions, please reach out to us there. And as it goes for the phone number and the email line, those of us that might be answering the phone might not always know the answer right away, but we will do our best to research that for you and get that to the right person who may have that answer. Dan had also mentioned our business resource page on our county COVID website page. So there's lots of different guidances there for things not just as businesses, but even childcare, schools, things of that nature as well. And then in addition, as was mentioned for the enforcement part, if you do observe a public health order violation and would like to report that and are looking for assistance to get that resolved, you can call the 24/7 available dispatch line for non-emergencies, which is 668-8600. I think that covers it for what I was going to cover, but otherwise we are happy to help address those questions. We know this is quickly changing information, and everyone is really calling in to want to do the best that they can and protect their business and staff. So we're going to do our best to help support you in that as well. But otherwise, thank you.
Thanks, Hannah. So I do want to just share my last slide just to remind you all that there's another survey that is going out for the Summit County Economic Impact Survey. I think there have been two before this one. Blair, you might need to correct me on that. Yeah. So I don't know if you want to talk more about the survey.
I'd be happy to. Thank you, Amy, and thank you to your entire team. I think that was a great presentation and really hit on those high-level topics that we needed to hear about. So Summit County Economic Impact Survey, the third one is taking place. It opens, will probably open today and will close on November 12th. It'll take 5 to 10 minutes to complete. It is conducted by the Summit Prosperity Initiative, which is the economic development arm of the Summit County Chamber. And it helps us gauge how our businesses are faring during this pandemic, track the recovery efforts, and provides a progress report for September through December to help us plan for the future. Amy is correct. We have done two previous to this. Some of the numbers that we're seeing is there is an estimated $464 million in lost revenue from March through August. So huge numbers here, and we've been open. So just to kind of nail home what Amy and her team are saying, you know, we really do have a short window to get these numbers back in line with where they need to be. And, you know, I was on a call yesterday, and I think Toby from the Breckenridge Lodging Association said it best. Whether you like this game that we're playing and you like the rules of the game, they're the rules. And unfortunately, we are a little bit at the mercy of the state at this point. And it's up to us to keep our community open and our community running. With that, if these guys, we've got about 4 minutes. I don't know if we can try to squeeze in just one or two quick questions. I know that we've got some around testing. You guys kind of touched on it a little bit, the false negative tests. But how are those, it seems like a lot of people are getting some false negative tests back. How are they calculated into the overall positivity rate? And an example was my test was negative, but symptoms pointed to COVID. I'm concerned those I exposed won't quarantine because of that negative test.
Lauren, do you want to take that one?
Yeah, I can speak a little bit to the false negative test. I don't like to think of it as a false negative test because most people are getting the PCR, which is actually detecting RNA in the nares. So it's detecting a specific genetic sequence of the virus. And if that swab is conducted and it's negative, it doesn't mean that, essentially it means that the genetic sequence of the virus was not detected at the time of testing. And which is why some folks get confused about why they can't be released off quarantine early if they get a negative test in the middle of their quarantine. It's because that virus has to incubate for 14 days. So if someone gets a negative test at day 2 or day 4 or day 7, it doesn't mean that they won't become positive later on in their incubation. So I don't like to think of it as a false negative. I like to think of it as it just wasn't detected at the time of the swab.
That was extremely helpful. Thank you. We've got a number of questions around capacity and specifically what that 25% of capacity looks like for retail. And I know that I think both Hannah and Dan tried to answer that in the chat. So what we'll do is we'll take a lot of these questions and try to compile some answers that we can then email back out to the group. One that I do have that probably will take about 2 minutes. How does the new public health order, specifically the new gathering size limitations, affect event facilities?
I can comment on that one. So as Amy had mentioned with that new public health order that came out yesterday, because of the state wanting to put in some further restrictions, it moved us into stage 3 restrictions for indoor and outdoor events specifically. And so for those restrictions, we went from indoor events going from being able to go up to 100 with the social distancing calculator down to 25. And then additionally with outdoor events previously being at 175 with the calculator, down now to 75. And so that will impact those venues that do host those events indoors. If they want further information on what that would look like, they can reach out to COVID questions and we can send over that guidance documents. But overall, I mean, you know, that is a pretty significant cut in those events. And that is once again to help limit on the gathering and mingling and to help reduce our case count here in the county.
Thank you for that, Hannah. So it sounds like, just to wrap up a little bit, that we're kind of teetering in between level 2 and level 3 on that dial. We really need to get back to level 2 numbers by next week to not get moved into stage 3 on that dial. And then we have about a 2-week period before we get moved to stay at home complete lockdown.
Yeah, Blair, and just to clarify, if we do move to level 3 restrictions next week, we then have to meet the metrics for safer level 2 for 2 weeks before we can move back into that less restrictive phase.
Thank you for clarifying that, Amy. I know that these guys have to jump from just one call to the other, so I don't want to take another minute of their time. But again, we will, a number of questions came through the chat, a number of questions that were asked in advance that we just didn't have time to get to. A lot of them, though, were answered in that awesome presentation. So we really do thank you guys. Hope that you get some rest this weekend. I know that you've been going just 24/7. But thank you to our public health team. Thank you to our business community for how hard you all are working to keep our community safe. We obviously can't do it without you, and we appreciate your efforts.
Thanks, Blair. Thanks for having us today. And yes, thank you. I hope you all understand what an amazing partner you are in the fight against this virus for us. And we appreciate all you are doing within your role in your part to do this. Thanks so much.
Have a great weekend, guys.